Hi, my name is Quinn from Health Age International. Welcome to my presentation on the Intergenerational Self-Help Club, or the ISHC, and its response to COVID-19 pandemic. Part number 3, the Intergenerational Self-Help Club, or the ISHC Development Model. The ISHC Development Model is a development initiative that provides control of the development process, resources, and decision-making authority directly to the community groups. The underlying assumption of the ISHC development models are that the communities is the best judge on how their life can be improved, and if provided with adequate training, information, opportunities, and resources, they can organize themselves to provide for their immediate and long-term need and development. Moreover, the IHHC development model is motivated by their trust in people, and hence it advocates people's full participation and ownership as a powerful force for development. By treating people as an asset and partners in the development process, which will make the model more responsive to local demand, is more inclusive and cost-effective compared to traditional development models. The ISHC development model is cost-effective and affordable for low and low-middle income countries like Vietnam. It is attractive for young and old, men and women, poor and non-poor. It is dynamic, able to be replicated in rural, urban, coastal, and mountainous areas and in all regions of the countries. It is replicable, as evidenced by its rapid growth throughout the countries. It is sustainable, able to continue to operate and grow even after when the funding ends. It is multifunctional, which enables it to meet the wide range of needs and wants of both the young and the old. A typical ISHC has at least 8 core components or main activity grouping, which is based on the top need of its members and communities. The first and most popular component is the social and the cultural component. The aim of this component is to preserve local traditions and customs and promote intergenerational bonding and mutual support. Second is the food and income security, or the pro-poor and age-friendly livelihood. The aim of this component is to improve the income security of its member and help the ISHC to have regular self-generated income for financial sustainability. The third component is the healthy and active aging. The aim of this component is to help improve health status of the ISHCs and community members. The fourth component is the community-based care. The aim of this component is to ensure that care service is accessible to all people that are in need, which consists of 4 types of care service, which are 1. Social care, 2. Personal care, 3. Medical care, and lastly, living support care. The fifth component is the self-help and the community development component. The aim of this component is to promote a more caring and supportive societies, people helping people. Component 6 is lifelong learning. The aim of this component is to promote regular cross-learning and sharing within the community, especially between the generations. Component 7 is the right and entitlement or legal service. The aim of this component is to help people, especially those most needy, to have access to the rights and entitlement. The last and the eighth component is the resource mobilization component. The aim of this component is to enable the IHHCs to mobilize local resources to meet the needs of its communities and its members. The ISHC self-generated income will steadily increase as it grows older and have more experience. A typical ISHC will be financially sustainable when it is 1 to 2 years old. The 8 core component of the ISHC is the key for the popularities and success of the ISHC development model in Vietnam and in the region. By August 2020, 3,412 ISHC have been established in 61 out of 63 provinces and cities in the country and directly benefiting more than 4 million people annually. With the new Prime Minister Decision 1336, the number of ISHC is targeted to grow to 6,500 by the end of 2025. Awards and recognition. The IHAC has received many awards and recognition, such as the grand prize winner of the Healthy Aging Prize for Asian Innovation. Second, was selected as best practice in achieving SDG. And lastly, was selected as best practice in healthy aging by WHO. National scale up. If the government of Vietnam invests just 0.02% of its 2019 GDP per year for 10 years, the funding will be enough to establish 100,000 multifunctional, self-managed, and sustainable ISCs in the country, or one IHAC in every village or urban communities in the countries. Part 4. The Intergenerational Self-Help Club COVID-19 Response. Vietnam and COVID-19. The first reported COVID-19 case was on 15 February 2020, and by the end of August 2021, there were more than 400,000 reported COVID-19 cases and over 10,000 reported deaths. Close to 90% of the reported cases and deaths were in the Red Delta and the Mekong Delta. To support the ISHC with their activity during COVID-19 pandemic, HealthAge International in Vietnam developed the COVID-19 manual for ISHC and local partners. To find out what were the ISHC COVID-19 intervention and their impact, HealthAge International in Vietnam conducted a rapid situation assessment of 111 ISHC from 9 provinces in the Red Delta, of which 100 ISHC were found to have COVID-19 intervention. These were their activities. ISHC conducted rapid needs assessment of the most at-risk and needy household. The list is then presented to and certified by local authority for future relief support. Even though the government of Vietnam has numerous interventions to mitigate the impact of COVID-19, however, there were still many remaining needs and gaps. Therefore, the ISHC expanded their local resource mobilization targeting government office, private sectors, faith-based organizations, and individual donors. The ISHC representatives were invited to local COVID-19 coordination meetings. The ISHC were considered important key players in local COVID-19 control and mitigation efforts. The ISHC provided volunteers to man community checkpoints and recorded visitors' temperatures and information. Prepared meal service for staff and volunteers at community checkpoints. Conducted regular COVID-19 communication and dissemination activities such as providing updates to stay connected with members through regular phone calls. 2. Raise awareness on COVID-19 through community loudspeakers. 3. Set up online chat groups to share COVID-19 information and provide door-to-door COVID-19 ISEC materials and encourage good practice. Supported local authorities and other organizations to conduct mobile information and dissemination. HealthAge International in Vietnam produces standardized COVID-19 message recording which the ISHC can use in their community loudspeaker information sharing activities. Mainstream new normal practice in the ISHC activities such as social distance, wearing face masks, hand washing, and regular temperature check. Support provincial health department to make liquid soap for distribution. Support local health department to conduct information sessions for trainers on the proper usage of face masks and hand wash with soap. Distribution of face masks and liquid soap. Distribution of emergency food and cash assistance to needy households. Provided special care package for older old and those that are frail. The 100 ISHC that had COVID-19 intervention had a total of 949 home care providers, providing regular home care service to 461 clients. Provide information to care provider on how to protect themselves and their client. ISHC links with local commune health station and/or retired health workers to provide regular medical checkup for their care client at home. Home care volunteers provide medical escort service to health checkup and follow-up treatment. IHSC also have social development fund which can be used to provide financial support to needy families to cover their out-of-pocket medical costs. The ISHC living support activity included shopping, meal delivery, running errands, house repair, and farm and yard work. ISHC regularly conduct environmental sanitation improvement in their community such as village cleanup, improvement, and disinfection days. Many ISHC also conduct their daily physical exercise online to promote stay active and healthy during COVID-19 lockdown. Encourage members to write and share poems and writings on COVID-19 prevention to boost positive thinking and localize COVID-19 message. To disseminate COVID-19 information widely throughout the country, HealthAge, in partnership with the Ministry of Health and UNFPA, developed a series of COVID-19 awareness and training videos, such as basic information on COVID-19 for older people, 10 things older people need to pay attention during COVID-19, how to protect older people in nursing home during COVID-19, care for older people at home during COVID-19, COVID-19 and older people, information for family members, guidance on quarantine at home for older people during COVID-19, and COVID-19 vaccination and older people. Part 5. Finding and Conclusion. The ISHC can greatly support local development and emergency response if they are included. ISHC can help state agencies reach those most difficult to reach like those living alone, bedridden, and extremely poor. Long-term collaboration between IHACs and local government service providers can increase effectiveness of service and relief support. Joint resource mobilization between IHAC, the private and public sector can greatly increase fundraising success. Thank you.